So now this lady, the baby that is in her uterus actually relies on these prostaglandins so that let me just call it their lungs open up so that the baby breathes naturally in the uterus. But guess what? You end up giving this pregnant woman diclofenac to kill pain. You did not ask her if she's pregnant, so you ended up dispensing diclofenac because you wanted that 50 shillings. She comes with a headache, you don't ask any question about this, and then you sell meloxicam to her because possibly, or celecoxib because it's the most expensive one, so you want to make the profits. What of using naproxen? Naproxen is actually a non-steroidal anti-inflammatory drug. It actually does the same, blocks this COX enzyme. So now look, so that diclofenac in that pregnant woman blocks this COX enzyme, this pathway. So you block this pathway and therefore you don't form the prostaglandins and therefore the pain disappears, right? But understand what? As that pain is disappearing in that pregnant woman, the ductus arteriosus in the baby closes up. When it closes up, this baby dies in the uterus. So a simple drug like ibuprofen or diclofenac in pregnancy can be very detrimental to the health of the baby. Now that has to be an emergency CS. So you can imagine just giving a painkiller ends up taking this lady for an emergency CS, which will not possibly turn out positive because again, there will be complication of the CS. And also the CS comes out and the baby is dead. I mean, are we willing to go that lane for the profits? Pharmacists and doctors, we are under an oath. That oath is for the benefit of the patient. It has nothing to do with us. Everything, those 4 principles in that oath are for the benefit of our clients. There's nowhere it mentions money or remuneration for the doctors and the pharmacists. There's nowhere it mentions any status quo for a doctor and pharmacist. That oath is there to protect the interests of the patient. That's why it has all that justice, that autonomy, that confidentiality. It has everything that protects the patient. So please, let's practice medicine. Let's not sell drugs. Let's not just write prescriptions because we want to push drugs. Let's be very cautious about this. These are the smallest things that can actually change your profession totally. Okay? So now we've blocked this pathway. We end up killing the baby. We end up, again, let's say like that lady is going for, she's in labor and she's going to give birth. But guess what? You've given her painkillers, maybe a diclofenac injection. And those of you who think an injection will work differently from the tablets, you're wrong. Even the one that you apply, the diclofenac gel, acts the same way by blocking COX. So you can imagine if you're thinking I'm giving an injection, no injection is safe, no injection is just quick and all that. No, they act the same way. They are all NSAIDs and their mode of action is the same. So I wanted you to pick that point there. Do not just go and pop, and you ladies and even men, always rushing to the pharmacy to buy diclofenac because it's 50 bob. Always rushing there to buy a painkiller. Always prescribing the painkillers. And then you even know your drug. You come and say, that orange one. When you just say orange one, the pharmacist knows, that one is diclofenac. They give you the best brand, the most expensive brand. Well. Now, another interesting story is here. You see this arachidonic acid, we said, is acted upon by one enzyme that is cyclooxygenase that will give you the pain pathway, right? However, when you use, let's rewind again. So one enzyme breaks down arachidonic acid to give you the prostaglandins, which are very important, but are very crucial and critical again when you mess them up, right? The other platform is this same arachidonic acid is acted upon by another enzyme that is called lipooxygenase. Do not cram the enzymes. Simply use COX or lipox. So lipooxygenase is another enzyme that actually acts on arachidonic acid to convert it to something that we call leukotrienes. Leukotrienes. Now listen, this is going to be very interesting. Those people who are suffering from asthma, asthma is an allergic reaction or an inflammatory reaction that hails from allergies. And allergies, specifically in asthma, they are caused by leukotrienes. So this pathway can yield benefits, can also yield problems, because leukotrienes are the ones that mediate asthma. So you see that pathway? So we have one pathway giving you the prostaglandins, we've talked about that. There's another pathway that gives you leukotrienes that will give you asthma. So that means it is very dangerous to give somebody a drug for pain that is an NSAID, non-steroidal anti-inflammatory drug, when this person is asthmatic. Why? Because that NSAID, that diclofenac, will come and block this pathway. But when you block this pathway, you have actually opened route or opened a channel to activate this other pathway. So yes, you blocked the pain successfully. Yes, you blocked the menstrual pain and you have suffered the consequences. Yes, you've blocked the inflammation, the swelling is disappearing. However, you have actually opened up another pathway that will be activated, that now this arachidonic acid, which is increasing, will be acted upon by lipox to give you leukotrienes. And therefore, if this person is asthmatic, they will end up having asthma, an attack. That is an emergency again. This tells you that people who are asthmatic should never take aspirin, should never take diclofenac, should never take ibuprofen, aceclofenac, celecoxib, and the rest as painkillers. Therefore, they are now limited to either steroids or paracetamol. Same to a pregnant woman. They are limited to either steroids or paracetamol. Are we together now? But as you go to buy that paracetamol, do not go and buy that combination, that one that has caffeine and all that. Please do not. Simply go and buy pure paracetamol. Hello? Am I making sense? Am I connecting the dots? Somebody is saying paracetamol doesn't work. No problem. Go ahead and use what works for you. Go ahead and use Bitapin. Go ahead and use diclofenac. You will never blame me because I put this live here. You will come back on this live and watch, and that's the time you'll start to understand it. Right now you can be ignorant because of the need of you wanting to be heard. You just want to be heard in the comment section. So you choose to say paracetamol does not work. It doesn't work. How doesn't it work? Simply fix what caused the pain, because pain is a symptom. I get so upset about people who do such things. Pain is a symptom. Pain is not a problem. Pain is actually telling you there's a problem in the system. Fix the problem. Fix the inflammation. Inflammation is coming from inflammatory foods. So why do you think drugs are coming in to change your life in terms of pain and inflammation? Why do you want the shortcuts? We are saying paracetamol has to work when we have an emergency. We are here, we cannot do anything about it. This woman has not started fixing her diets. We've not explained these things to her. Now she has the pain. We have to handle the pain. But before we handle the pain, we must know where the pain is coming from. Because pain does not come from the skies. There's somewhere pain comes from, right? Yes, there's somewhere pain comes from. So pain is a symptom. So when you focus on treating pain, when you focus on treating a headache, you're getting it wrong. You're getting it wrong. Let's find what is the nutrient deficiency. What is the problem? So that we fix that problem. And through fixing that problem, the pain disappears. When you have malaria, you have headaches and weak joints. So do we give you a drug for the joints? Do we give you a drug for the headache? Or do we give you an antimalarial? And when malaria disappears, the symptoms disappear. So when you block this pathway, you open up the pathway for asthma, you end up getting asthma. Therefore, it's very necessary that if somebody is buying any painkiller, simply understand that you must know if they have asthma, and you even ask to tell the pharmacist, hey, I am asthmatic, is this painkiller going to work for me? But of course, most of the pharmacists sat near the window. And the only thing that they came out from 5 years of studying medication and their mode of actions and how they work and their side effects, they came out with 2 times 3. Now they become a window pharmacist. Just mbili mara tatu, moja mara nne. Hii weka huko chini. Weka huko chini. Then a woman puts that drug under the bed. And tomorrow they come back to hospital with the same urinary tract infection. Then they tell you, but uliniambia ile niweke huko chini. So I put it under the bed. You're like, yeah. Hey, the health system is totally messed up. Mbili mara tatu, 2 times 3. That's some that doesn't have an answer. So now, if you've not understood how painkillers are dangerous in pregnancy, how painkillers are dangerous in asthma, how painkillers are dangerous in menstrual cycle and menses. This was the most important part of this. And I know my students here, if I ask them what is the mode of action of diclofenac, they will simply tell me using this diagram. The easiest diagram to explain the mode of action and then the side effects of this medication. And maybe as a recap, let's go through it. So you break down the cell membrane, you get arachidonic acid, you break it down through two enzymes. One gives you the prostaglandins, the other one gives you the leukotrienes. The one that gives you the leukotrienes stimulates asthma. The ones that give you prostaglandins stimulates pain, inflammation, helps you in menses, helps you in childbirth, and then helps you open up blood vessels that flow into the kidneys so that your kidneys are perfused. Blood flows in them, they keep on functioning. And then the same prostaglandins open up the lungs of your child so that the baby in the stomach can actually breathe naturally. Now you block one pathway that inhibits pain, you open up another pathway that brings about asthma. Therefore, don't use painkillers in people, the NSAIDs in people who have asthma. But the most important part about this diagram is, you see on top here, when you're trying to convert the cell membrane phospholipids into arachidonic acid, there is a drug that can actually block here. So when you block the first step here, you will not form arachidonic acid, therefore you will not form leukotrienes, and you will not form prostaglandins. Do you see the beauty? So the drugs that actually block here, there's an enzyme here called phospholipase A2. The drugs that block here are the ones that we call the steroidal drugs. So therefore, steroidal drugs, under lower doses, they can be healthy in somebody who's trying to manage pain and somebody who's trying to manage asthma. So yes, hydrocortisone injection can be used for management of pain. Dexamethasone injection can be used to manage pain. Prednisolone can be used to manage pain. And yes, they will not expose you to problems with menses. They will not expose you to problems with birth. They will not expose you to problems with your child. Actually, dexamethasone is injected in women who are about to have a premature birth. Those women who possibly their child has to come out at about 7 months or so, you're injected with dexamethasone injection so that the lungs of the baby can get to mature. So now you see why it is important to maintain the ductus arteriosus open so that the baby can breathe. So you see, when you use a steroid, you block the first step, therefore there will be no pain, there will be no inflammation, the menses will continue as usual, and also asthma will be suppressed because you've blocked all this pathway, and therefore you're not forming any leukotrienes and you're not forming any prostaglandins. So it's a beauty, right?